I've got IBS. Now we're dealing with people who have like palpitations, malaise, fatigue. I can't breathe. My brain doesn't work. Like multi-organ symptoms. And so I think this vagal tone and polyvagal theory is key. So what you were mentioning, James, is I myself, until I started researching polyvagal theory and did the course by Dr. Stephen Porges, did not understand that there were actually two branches of the vagus nerve. And it's important to understand this when you're looking and evaluating patients, because when you see a patient, we think of the two categories: sympathetic nervous system response, which is that tiger response, the fight and flight. So either you're going to run from the tiger, it's a very active, I'll call it the hot button response, right? It's the movement, action, anger, that response. Then you also have another survival response, which we forget about. And that is what we call the dorsal vagus nerve. And that is the deer in headlights frozen response. So that I'm going to call the cold button survival response. So when you see people who have malaise, fatigue, and the low blood pressure, just pre-syncope, this is all the dorsal vagal response. The palpitations is the hot button response. And in dysautonomia, those buttons keep getting flipped. And that's the problem is it feels horrible to be hot and then cold and hot and then cold from an autonomic point of view. So I look at these as two children, the hot button and the cold button. And then you have your ventral vagus nerve. And this is the calming mama. Okay, it could be the calming parent, but this is the calming mama. And these are the two kids, hot and cold. So if you have great ventral vagal tone, she or he will kind of keep these two kids in check so that they can't just go all over the place. However, if you lose ventral vagal tone, this kind of like back and forth starts to become really old for patients. And because conventional doctors are always looking for, well, is it hyperthyroid or is it an SVT? They only know it as one or the other. They don't, middle finger. The idea is that they don't think about it as alternating. And the way you get that alternation to stop is to increase ventral vagal tone. So don't think of it as just sympathetic and parasympathetic. Think of it as ventral vagus mama. And then you got your hot and cold kids, sympathetic and dorsal vagal nerve. That's polyvagal theory. And it's all about increasing ventral vagal tone. And you use heart rate variability as a measure of ventral vagal tone to see how you're doing. In fact, what's really cool is if you measure heart rate variability, you can find dysautonomia early and start preventing all the autonomic dysfunction to the heart, to the nerves, to the brain. It's like an early marker of what's to come.
Yeah, so heart rate variability obviously has been like around forever, and increasing in popularity and increasing access, right, for a long time. So I think a lot of practitioners love getting that information, even if it's, not easy to add into your workflow, but ultimately that's powerful. What are some basic lifestyle medicine stuff that can increase that number or can improve that? Sleep, I'd imagine.
Sleep is absolutely great. Exercise is likely the best one in terms of, well, I guess I'm going to say it's the best one for certain personalities. Like, some people just love movement. So exercise would be a great one. And obviously you have to stage that exercise. If you're prone to dizziness, you're not going to get on a bicycle. Meditation or deep breathing, mindfulness, as long as your exhalation is longer than your inhalation, you're activating ventral vagal mama. Okay, that's what we want. And that's what exercise is doing. When you get in the zone with exercise, that's ventral vagal mama controlling the two children. The other things that we don't even think about are anything that can cause the vagus nerve to be activated. So gargling, you've got a vagus nerve in your vocal cords, humming, laughing, singing, chanting, all that, you've got a vagus nerve up here. So you can activate the vagal tone just by doing something like that. Also think about what you could do to be good to your gut, because anything that kind of gets good to your gut is good for the brain, and the brain is kind of central for autonomic nervous system health. Then there's all that stuff related to cold water therapy. I'm sure you've talked about that or heard about it, James.
Not only have I heard about it, but I worked out that at the elevation that I live right now, which is higher, I've lived for the last year, my pool, instead of just being, basically for the whole 9 winter months, is like a massive Wim Hof bath.
Right. So that is one, for those who like that, that's another way to stimulate the vagus nerve. You're kind of, you can use that for migraine headaches, by the way. You're just triggering the diver response reflex by doing that. I don't personally, I'm going to say this other thing. There are some people, including myself, like if you ask me to sit down and try to meditate on some single thought, I could last maybe 90 seconds before my mind is thinking of 17 different things. So there's a lot of technology in this space as well. You can use binaural feedback because you've got your vagus nerve coming into your auricular branch here. You could use pulsed electromagnetic field. You could use microcurrent stimulation to the vagus nerve. There's also like heart rate variability biofeedback devices. So some people are really techie. So I feel like we need to find people with how they would like to just like exercise. Like not everybody loves weightlifting. Okay. So you got to find out which exercise gets them to do strength training. Like for me, it's yoga. I don't like dumbbells, but other people want to go to a gym. It's the same thing here. We got to find out, is it movement? Is it diet? Is it sleep? Is it technology? We got to get that vagus nerve exercised.
Yeah, great. Well, look, I want to talk about groups because I always have to talk about groups somehow with you, because I think we're both, clear that this is where things are going, and it's very healthy to be in groups. So what things happen in a group that might improve vagal tone? Obviously, you can layer on top of those things all the lifestyle medicine stuff. You could hum in a group, you could chant in a group. Probably the reason why, that kind of thing, one of the reasons why those kind of things became popular historically is because of the health benefits of them. But what is unique about in the group in creating safety and improving vagal tone?
Yeah, thank you for bringing that up, because I completely agree that this is our thing, you and I. So when you're in a group, first of all, the whole ventral vagus nerve came about in an evolutionary perspective, because when reptiles existed, they did not need their mothers for milk. But when mammals came along, we needed to develop this ventral vagus nerve because we needed to be able to consider our mother safe and socially engage with her in order to survive. But in order to know if, X was my mother or Y is my mother, you have to be able to read facial expressions. So your ventral vagus nerve is essential to read other people's facial expressions and know if you feel safe or not. It's a subconscious thing. Like whether I can look at James and get a sense of whether or not I feel safe with him from a subconscious level before my consciousness is ever able to determine that. And that's related to the ventral vagus nerve. So for social engagement to occur, you need a healthy ventral vagus nerve. Now, the more you get into healthy social situations, like a group visit where you're meeting with people and you have a sense of security and a sense of belonging. Please remember those two things, a sense of security and a sense of belonging, because you've got to have the sense of security to keep ventral vagal mama in play. Because remember, if sense of security is not there, then these two kids come out to play. So you got to have your sense of security first for ventral vagal mama to even get strong. And then a sense of belonging is just next level in terms of getting that ventral vagal mama to get strong. So any type of community, that's why you see so much literature about community being a big part of healing. Because when you socially engage with people and you feel safe and you feel a sense of belonging, you are working out your vagus nerve.